So as Elizabeth said, this is the Medicaid unwinding training for enrollment assisters, where a lot of you had been on our previous training where we scratched the surface of this stuff. But this is where we're really going to dig down and learn how to help consumers renew and what their options are if they're unable to through this unwinding that's coming up. So we'll do some level setting. I'd like to say that I am joined by Maciel Gomez from VHS, who is a great allied resource and just really handy to have around for those questions that are undoubtedly going to come up. I invite questions throughout trainings that I do. Elizabeth can monitor the Q&A, and if there are natural breaks, we can stop and answer them. Otherwise, we can save questions for the end. But yeah, if there's a succession of things that we want to build on, I'm happy to have that tangent and have that conversation. So we have everything we need to do that. So today we're going to go through level setting. We're going to talk about what is the unwinding again, just so everybody has the scope in mind. We're going to look at Medicare Plus Medicaid renewals overview. What is it? Because we haven't seen it in a long time. My access nexus, Wisconsin.gov especially. What happens after there's an eligibility determination? What are options if somebody doesn't agree with the decision? And then if somebody can't renew, if they're no longer eligible, what options do they have? As well as some other resources for assisters doing this work. So broadly, the unwinding, the process of moving from continuous eligibility to the pre-pandemic routine renewals and eligibility policies. So back to business as usual. That's the idea here. But Wisconsin, obviously, our goals here are to implement a successful return to routine operations, such as annual renewals, which is where we're headed right now. And we want to help Wisconsinites stay covered. We want to make sure that people don't lose their benefits prematurely, that they can keep their Medicare, Medicaid right up until the renewal date and after if they're eligible, and that good communication is getting out so people can transition to employer coverage if they need to, or the marketplace. So just a little more overview here. During the COVID-19 pandemic, obviously, you're an assister, you probably know this really well. Medicare Plus and Medicaid renewals were all paused, the terminations were paused. And now we are into this new timeline of key dates where now people are receiving their renewal dates, which we talked about in the last webinar. They were able to see them in Access and My Access, and then they are also receiving letters now with their renewal dates, which is cool. April 1st, so just the other day, we now have new Medicaid enrollees are subject to the pre-pandemic rules for maintaining Medicaid eligibility, meaning anyone who enrolled April 1st or later is now on a normal annual review schedule. We are back to business as usual. May 31st, there are those that can't renew, the ones that will need to reapply. They'll lose coverage, but they are being sent letters to take action in April, so they're not hanging. But yes, that is a population to pay special attention to because they can't renew. We'll talk a little bit about them later. And then the renewals begin proper in June. So renewal deadlines are spread out over 12 months between June 30th and May 31st. So this is specifically for the unwinding. Roughly 1/12 of the Medicaid members will need to renew each month. We're talking 1.6 million people on Medicaid badge care right now. People can find out their current renewal date by creating an account on access.wisconsin.gov or through the app, My Access. And just a reminder, I'm going to say this probably a number of times about renewing too soon can cause a member to lose their Medicaid health insurance unnecessarily. I know that the IM workers are being told to help people not renew too soon if you've got a really proactive consumer, but I really can't emphasize that enough. Do not let someone renew early if their date isn't up yet, because they can absolutely keep their benefits for longer and use those benefits for longer. We will talk more about that. Arrow. Okay. So as I was saying, 1.6 million people enrolled in the program. Total enrollment was 1.2 prior to that, but now we have this huge population over the next 12 to 14 months. And then the key here is that the IM agencies normally in the past, so when I would do a renewal or want to do a renewal, I would pick up the phone with the consumer and say, let's call, let's share your information over the phone. And we would just do it that way. It'd be the easiest process. Given the volume of consumers we're talking about here, the volume of members we're talking about here, we have the IM agencies are going to be overwhelmed. Call times, call volume is going to be through the roof, and we're going to need to use every other resource and community partner we can to make sure that people are being seen and served and are able to get assistance to either renew their benefits or find other coverage. So that you guys as assisters, that's why this is especially important. And that's why we're going to go into access.wisconsin.gov a little bit and talk about that. So My Access, first, we talked about this in the last webinar as well. The My Access mobile app, people should create an account on Access and use the My Access app to stay up to date on their account. We talked about last time finding the renewal date, very easy, updating contact information to make sure that you're getting, the member is getting the notices in the mail or email that they want. Yeah.
I apologize for interrupting, but if you could just slow down just a little bit. Someone's asking for the pace to slow down.
Oh, that's no problem.
Just a little bit. Thank you.
Not a problem. You can push notifications, you get reminders when it's time to act. And what we'll talk about for documentation a little bit later is taking photos is one of the most useful things you can do in My Access is take photos of the proof you need to submit for different things that it asks for. And yeah, you can use the QR code or go to the Google Play or Apple App Store and get the My Access mobile app. And it'll be like our little companion piece as we go through this. Talk about My Access a lot. So you can help consumers download the app to sign in. Signing in the first time, they do need one of the numbers, the case number, Forward Health ID card number, or the Quest card number. It's important to know that Forward Health ID card number is actually the number, the ID number, not the actual like 16 digits across the card. So that's the number they're looking for on the Forward Health card. So in My Access, you can find the renewal date. You'll tap check your benefits, go to Badger Care Plus and check your renewal date. And then double check the year. We really wanted to emphasize this just because we've had some people come to us and say, oh, I've got to renew right away. My date's in April, my date's in May. But then, you know, upon closer inspection, it was 2024 and they actually had a lot more time and a little bit of relief at that. So double check the year, be really certain, don't act too soon. Covering Wisconsin just developed a brand new how-to sheet for consumers about who are worried about losing their Medicaid Plus or Medicaid. And it's really, I think it's a really useful sheet for people, especially assisters helping consumers. It has step-by-step instructions on how to check renewal dates in the app, so not unlike what we just did. Contact information for experts, so you can talk to a navigator or an assister. You can get online to our chat bot, explains when to renew, and it lists the other options that may be available if members no longer qualify, which is what we'll be talking about a little bit later. So let's talk a little bit more about renewals. Any questions so far?
Nope. It looks like Maciel or I have answered them in the chat.
Excellent. Thanks, guys. So what is a renewal for Medicaid or Badger Care Plus? It seems like we're starting really basic, but it's been a while. It's been a while since anyone's had to do one of these. So now that continuous eligibility is ended, Badger Care Plus Medicaid members need to renew for the coming year. Normally, renewals are completed every 12 months. And at that time, members may be asked to provide proof of information on the renewal application. And benefits end if the member does not complete their renewal by the due date. Now, renewals during the unwinding, so we have between June 2023 and May 2024, the 1.6 million people have to complete a renewal. The renewal dates have been assigned, as we talked about. Members should renew within 45 days of their renewal date. They should not renew early. The message we want to get out is check the date and wait for that 45-day window. Because if somebody renews too soon, benefits will end early and will no longer qualify if they no longer qualify. So just, I don't know how many times I'm going to hammer that home today, but it might be a lot. So the renewal notice people get looks like this. It's pretty straightforward. It is about as big as you could get across the top of a banner on what the date is. So people come to you and say, this letter, I got this, and then you can explain it to them, walk them through. I love that you do not need to take action at this time. I think that's crucial, because the messaging of get the date and wait. So this person shouldn't be thinking about this until, August. So I think keep an eye out for renewal notices, and you can help consumers understand them. Now, there are several ways to complete a renewal. We'll be looking at online a lot specifically, but I mentioned already you can do it over the phone by calling the IAM agency. Calling the IAM agency, there's the link there with all of the different consortia. And just a note again, just because the call volume is going to be this unprecedented level, that we need to use other options. Like, as much as easy as it used to be to pick up the phone, it's going to be that much harder now, because so many people are going to be trying to get through on the phone. I can only imagine that the workload is going to be immense, and we'll want to utilize some of these other options. Mail. A consumer will get a renewal packet mailed to them. A member will, who needs to renew. They can fill everything out and send it back in. They can physically go to the IAM agency and do the renewal there in person, or they can go to access.wisconsin.gov. Most efficient way to renew, which we'll look at. Can't renew through My Access, but you can renew through access.wisconsin.gov. So just really want to highlight some training tools too, because in some ways, these are going to do a better job than almost anything I say today. Training tools on the DHS Vimeo Access site here are really good. They walk through renewals, make it super easy. And honestly, it's one of the things I'd like people to take away from today's training is that renewals are easy. They should be easy. We'll probably end up in the weeds with complex cases and things like that, but the actual process is pretty straightforward. So definitely check out this link and use the resources that DHS has provided, because they're good.
And we have a question.
Yes.
So one person is wondering that anytime during the 45 days before renewal date, one can update via whatever application they choose. Is that correct?
Not sure one can update.
I think we need more clarification on that question.
Yeah.
So, Wanda,
yeah, Wanda, if you're able to.
and we have a couple questions, Adam, that I've been screening that we can answer live. So when you have a next break, we'll go ahead and we'll answer those.
Sure, I think it's coming up in a second. So yeah, also in the same vein, the resources here is DHS has this page on renewals and a sheet that explains the process also really well. So I'm not in the business of reinventing the wheel today, and I want to make sure everybody has all these great resources that already exist. So definitely check out these links. We'll get everybody the slides when this is over. We'll send out the evaluation and everything. But yeah, before we look at access, now is a good time for questions.
Okay, Beth, if you allow me, sorry.
Yeah, of course. Yeah, no, you're great. Go ahead.
So there is a question. The app and having an account are great for those who are young and have no language barrier. But for those who are old, technology and language are problems. What is there to help those people? And I think this is a great question for you, Adam, in terms of what CACs can provide in assistance.
Yeah, navigators, CACs, so certified application counselors, we have access to language lines. We're going to do whatever we can to find ideally an assister in that person's native language. We've been cultivating our networks for a while to make sure that's possible, especially Hmong and Spanish. But when that isn't an option, there are interpreter services we can use through either the federal government or through UW, and we will do everything in our power to make our services as linguistically and culturally appropriate as possible.
Okay. And the next question that I have here is there a way that service providers can find their patients' term dates to better remind, support, and assist them? And the answer to that question is providers have access to the Forward Health portal. That portal will let the provider know if they are eligible for benefits on that day. It will also show their term date. However, to better inform patients and clients, I would encourage the providers to have the patient or client log on to their Access account or their My Access app. And on those particular platforms, we are providing their renewal dates. And that's when where they will have the renewal date information available to them. There's another question as to will the renewal dates be provided on Forward Health? The answer is no. There's two different platforms. I just want to explain that the renewal dates are populated in the CARES program, which is managed by the IM agencies, and that's where they manage the benefits and all of that. However, the Forward Health portal, the task of that particular system is to go ahead and just show eligibility for providers, so it has a different functionality. So to answer the question whether or not the renewal dates will be populated in the Forward Health portal, the answer is no. Definitely encourage the use of Access and My Access.
That's really helpful. Thanks, Marcial.
Absolutely. And just so you know, renewal dates, the renewals do not require an interview. That would be food share. However, please note that if there is something questionable when it comes to a renewal and a worker needs to contact the applicant or the participant, there may be some contact that's needed. However, a renewal does not require an interview. That's usually food share.
Yep, and I think we're getting ahead of ourselves now, so we can definitely launch back in and pick up questions as we go.
Perfect.
Thank you. So what's the difference between a renewal and a new application? So a renewal is going to be different. It's going to be easier starting a new application Access because it's going to pre-populate with information that you provided the system and the system's been able to find using data matching and things like that. And you can just go through and click what you need to verify or change or update. And know that if you miss your renewal date, you could do a late renewal within 3 months. So if you can, if you're eligible, you can do a late renewal and actually backdate those lost benefits. So after a 3-month window, though, you need to start a new application. Don't forget, population of Medicaid members cannot renew and will have to complete new application by May 31st. Many of these are no longer eligible for Medicare Plus and will need other coverage. Just letting assisters know, remind them about this population because it's one that we're obviously paying some attention to now, and letters will be going out to them in April this month. Wow. So a few other considerations for food share and EBD Medicaid, because we're looking specifically at healthcare renewals, and we'll be looking at a healthcare renewal today. But a lot of times you will renew other benefits. You have the option to do that in the system. You can renew food share. There'll be additional questions about the household, including, as Marcial alluded to, the interview typically happens for food share. If you're renewing for EBD Medicaid, there's probably going to be an asset test and potentially other program requirements depending on if it's an institutional level of care, things like that. So just have those handbooks ready. I have them in the resources at the end of this thing. So we're in Access. I'm going to go down to the left-hand side menu and go to Renew My Benefits. And you can just click Healthcare, and you'll see your renewal date there as well. without clicking renew events, I believe you can also see your renewal date if you go to your letters first. If you just view your letters, you'll probably see the one with your renewal date as well. So you don't start the renewal process, but shouldn't be a problem either way. So you select healthcare, then you continue. My mouse is really, really fickle. I don't like it. Its wheel is like out of control. So you select healthcare, maybe food share, and then you submit. And then you're going to go through each of the sections that you probably remember from way back when you did access applications. So there's people, that's going to be who's in the home. There's going to be job income, you know, how much people are making, who are the tax filers, et cetera, bills, rent, et cetera, electric bills, utilities, offsets, and then other benefits and other income, maybe offers of other coverage, things like that. So you'll go through and basically update and verify each of those sections. It's not particularly challenging for sisters who've been doing this for a while. And consumers, I think, will find it pretty easy, but it's been a while again. So this could be something that's very new to a lot of people. So don't be surprised if, you know, there's just a lot of questions on why are they counting this? Why are they counting that? But yeah, you just make sure the answers are right when you hit next. And then at the end of the renewal application, you're going to read with the member writes, and then go to the electronic signature box, and they'll type their first name, middle initial, last name. And what they're doing there is agreeing that everything that they put into the application is true to the best of their knowledge. And that will complete the renewal. And if you stop short, Marcial, correct me if I'm wrong, if you stop short of that submit, you have not renewed, right? Like say you're in the process and you're going and you maybe we're in danger of renewing early and you go right up to that. As long as you don't hit submit, you have not renewed, correct?
Yes, you must hit submit in order for it to be transferred over to our system to process.
Okay.
They can certainly come back to it or what have you, but you need to hit submit in order for that. Just clicking the renewal button and not completing the renewal is not sufficient.
Right. Yeah. So the context came up was like the inverse of that, where somebody was worried they renewed too soon, but they only hit the button, so they were okay. But yeah, absolutely, you got to follow the process all the way through when it's time to renew. Once it's submitted, you'll submit the application, and it'll let you know if you need to send in documents. Upload those through the My Access app is easiest. You can take pictures right with your phone and upload them that way. Otherwise, you can fax if you can find a fax machine. No, if you can mail in your documents, drop them off in person at the IM agency, or it'll let you skip the step for now, and you can revisit it, which is something a lot of people do. You don't always have everything you need to provide verification. But yeah, I think the easiest way is uploading to the My Access app. All right, eligibility determination and next steps. Let's stop for questions.
All right, so one of our questions is, will renewals be processed immediately upon completion? If someone completes the renewal in June and is not due until August 31st, will their coverage be terminated before August if they are no longer eligible?
I can take that one, Adam.
Please.
Right now, the message is, please do not renew your healthcare benefits until the time comes for your renewal. However, we are well aware at the department there are some folks who are anxious and they're submitting renewals prior to the renewal date. And in order to prevent folks from losing eligibility that they could potentially keep for a couple months out, maybe even a year out, because we have 12 months to conduct this unwinding process. IMs are directed by the state right now to do an outreach call to that individual to confirm whether or not they want to move forward with that renewal, providing information, letting them know, listen, you don't have a renewal date set for said date. However, we see that you submitted a renewal and we want to make sure, is that something you want to move forward to, or would you like to withhold that renewal? That is all strictly dependent on whether or not the IM agency can contact that individual. So if an individual renews early, submits that renewal, not just clicks that button, but completes the renewal and submits it, the IM agencies will then do an outreach call to the individual who renewed early to see if they want to move forward with that or not. If they do not get a hold of that particular individual and they have the renewal that was submitted, they will have to process that, and the individual could potentially, if no longer eligible for Medicare Plus, potentially lose their healthcare coverage.
Thank you for covering that, Marcial. I just heard about that and I was gonna ask you about it anyway, so this is perfect timing. No, that's really great that the IM agencies are able to do that while they have the capacity right now, I assume.
There's another question, Adam. One of the healthcare centers is asking if there's any way to have additional trainings to navigate the system. I would imagine that they're referring to the access system and the My Access system, and we do have some demonstration videos that are absolutely available for our partners. They're not for members, but they're for our partners to learn and navigate the system. And I'm sure that Adam will be happy to share with you all once this training.
Yep, absolutely. And then links to the training site as well. So
we have another question that says, can a generic social worker do the renewal online with/for a member? How do we get into the access site?
So renewals for healthcare should be conducted by the person who the renewal is for. And if that person is unable to do so and they have designated an authorized rep to represent them, to complete that renewal for them, they can go ahead and do that. However, to answer your question, a random social worker, designated social worker who's manning their case, unless they have the proper documentation on file for their case, they will not be able to do renewals for them unless they're an assigned authorized rep.
Thank you. And we have another one that says, how often do people not have all the paperwork or know the information that is being asked for? Is it common? Is there a way to help people know what information they need to have to renew for the renewal process for it to go smoothly? What are the most common pieces that people miss?
Yeah, no, it's very common, totally very common a lot of times you want to start the application, make sure you lock in your application date. You're not going to have everything ready at hand, but we have a fact sheets, and I know state as well lists out things that people commonly need, but like, having your social security number, having your income statements. Income tends to be one of the bigger ones. Immigration status, anything like that can slow it up a little bit. But yeah, we could definitely, I know we have sheets that list what to bring and what would make the process easier. So we can provide those after the training.
All right, our next question is, you were suggesting using the app, then went into the My Access online, which has different navigation functionality. Many consumers do not have computers, but do have smartphones. Is the app version as easy to use for renewals?
So, Marcio, do you want to go?
Go ahead, I'll chime in if need be.
Okay, so the one drawback with the My Access app is that you can't do a renewal on the app. It is it's very useful for completing the process. So if you can get online, say they go to a library or start the process, or even if they start the process over the phone and they need to submit documentation, you just can't complete the actual submit the renewal application via My Access app. But you can use it to finish the process by uploading documentation.
Perfect. Our next one is, who can assist with renewals? Can a clinic help its patients?
That's a broad question. So ideally, a clinic has certified application counselors who are trained to do Medicaid and Marketplace, because especially with these renewals, a lot of people are going to become ineligible and are going to need other options. So you're going to want experts, CACs, navigators, agents and brokers who know their stuff to make sure these people land in the right place with the feet beneath them. So I guess there will be a lot of people out there, social workers and folks helping with access, but in terms of maximizing somebody's next steps and their options and understanding their health insurance and what's going to happen, you want to get them to an enrollment assistant specifically.
All right. Will not being able to upload documents prolong the determination process, or will that be gathered during the interview process as usual?
When an individual has a renewal that is done, that is needed for healthcare, that information is sent out to the client 45 days prior to the renewal date. Within that 45 days, that individual has time to prepare for their renewal, and that in turn also allows them time to submit their verification. Verification can be sent, the documents can be sent, via mail. They can be faxed on over to their IM agency or the centralized document processing unit. However, they can also download the My Access app and be able to take a photograph of that. So they will need all necessary information, whether it be income, whether it be verification, to process the renewal completely. It will not be processed without the necessary verification.
Right.
All right. Do individuals need to submit POA guardianship documents if they are the activated rep? Do they include these forms? A member who is incapacitated would be unable to sign an authorized rep form.
This is a high-level question, and I would recommend that you email the DHS Forward Health Partner inbox, and I will respond to that individual with that email address.
That's a good question, though.
Awesome. Can you give us any more specific information on what groups of people are needing to reapply for Medicaid? We have been told this is the IC only population, or people were manually extended throughout the PHE. It's not actually clear what groups are part of these populations. Is it SSI, MA, emergency services, or others?
Marcel, can I kick that one over to you? Because this is something that's come up a
Yes.
lot, and I've heard the answer, and I've said the answer too, and I just want to hear it again.
Yes, so the IC only population, it's about 80,000 folks. And they are individuals who have either had healthcare benefits open in their, and one of the questions previously, well, what is an IM agency? It's the income maintenance agencies. That's what IM stands for. And it's the local consortiums, those who actually manage those benefits, those cases. So just wanted to go ahead and answer that question while I was talking. But so the individuals who were in IC only had a case open at their CARES case, at their local IM, at their consortiums, but for whatever reason, those cases closed during the pandemic. So someone reported they were over income, the IM agency went ahead and closed that case. However, legally, the Department of Health Services had to extend their healthcare coverage. And the way that we maintained eligibility was maintaining them in the Forward Health portal, where the doctors could scan their card and see that their eligibility is still open. So that's some of the population that is in the IC only, those who lost a CARES case and actually have to reapply so we can redetermine whether or not they're eligible. The other folks are those who are on tuberculosis Medicaid, those who have emergency services only, women who were pregnant during the pandemic that need to go ahead and either reapply because they're pregnant or their coverage is terminated because they're no longer pregnant. And those individuals who have, I believe, express enrollment and things like that. So there's a variety of different categories that are in that population. So they're essentially those who do not have a CARES case that were only extended in the Forward Health Portal. Adam, does that make sense?
I was gonna thank you, Marcel. That was the best answer I've heard to that question ever. Like I really, really appreciate how thorough you went on that. I think it's really useful.
And again, if you have other questions on that, feel free to email the DHS Forward Health Partner inbox.
Fantastic.
All right, so our next question is for assisters, do we use our assister number? Currently, we are signing in as a staff or volunteer at an organization.
I'm not sure I understand the question. Like, does this use an assister number on an access application?
That is my understanding of the question.
We might have to answer that one offline. It's really specific, and I'm not sure where we're going with it.
Yeah, agreed. Sorry, we'll take that one back.
All right, looks like we have a couple that might be answered in the next bit of the webinar. So I think we'll hold on those for a little bit.
Perfect. Thanks, Elizabeth. Okay. So once you submit, try to remember where I'm at for those questions. Once you submit the you get the eligibility determination. After a member completes the renewal, the agency has up to 30 days to process it. That used to be a lot faster, I think. I don't know if we'll be pushing the 30 days with the volume we have ahead of us, but it's just a personal question that I have out there. Member will receive a notice of decision saying whether or not they're approved for or denied healthcare benefits. And then there's, of course, often a request for verification. And you'll see a notice of decision, and it'll indicate who in the household is eligible for what. You see these tables. I think we have new notices to look forward to sometime in the future. This is the future, maybe. But you'll get used to seeing these notices of decision. In this case, Badger Care Plus, no monthly premium. And then for people who, say you manage to keep your benefits, so remember, members have 10 days to report any changes. Changes, typically any change in income, technically it's over the threshold, but like members should be thinking any change in income. If they move, there are household changes, somebody gets pregnant or somebody moves out, marital status, whether or not they get access to other insurance, change in expected tax filing status, which kind of goes with the living arrangement one too, and any change in tax dependence. Basically, any of these changes happen, they've got 10 days to report that in access or to the IM workers, so their case is current. And then there are going to be people who are no longer eligible. So this is kind of what the crux of this whole thing is that a lot of people are going to lose coverage. We don't want to scare people. A lot of people are going to keep coverage, but Robert Wood Johnson Foundation Urban Institute estimate about 300,000 Wisconsin members may lose Medicaid, Medicare Plus, and these people will need to transition to other health insurance coverage. Now they do have options, and we're going to talk about those. They can connect people who are no longer eligible to other forms of coverage through their employer-sponsored coverage, healthcare.gov. Some are going to be Medicare eligible, and then for people who fall through all other cracks, there's got to be free clinics at federally qualified health centers. You can always call 211 to get help. Let's jump briefly into the fair hearings and then take questions again. So, if someone doesn't agree with the determination of their case, of their application, they can have a right to request a fair hearing from the Division of Hearings and Appeals, DHA. Linked here, and you'll get the slides, is the request for a fair hearing form, or they can write a letter and send it to the DHA, indicating that they want a fair hearing. again, this process probably hasn't been used much in recent years, but it's certainly something that could happen a lot as we see complex Medicaid cases occur over the unwinding. So we might be more familiar with this by the end of the whole thing. But DHA can schedule a hearing or they'll dismiss the request. They'll give a 10-day notice prior to the hearing date. And then importantly, they can determine that benefits will continue. So say if person disagreed and was given a termination, said benefits were denied, and they said no, they really should be, they can continue. But if a consumer loses that appeal and is using that health insurance, they may end up on the hook for those payments if they lose the appeal, right? So like if Medicaid paid and then it found out that they shouldn't have had Medicaid because they weren't eligible, then they're on the hook for those payments. So there's something to keep in mind when benefits are continuing like that during an appeal. All right, questions?
Okay. So this question says, when term dates are not aligning in Forward Health Portal, which date would be their actual term date? Example, MAP ends 5/31/23, Medicaid end date 11/30/23, QMB end date 11/30/23. As someone assisting, what would be the term date when they have multiple types of Medicaid?
That's a really good question. I know, Marcia, correct me if I'm wrong, they're trying to line up the term dates as much as possible, and the end dates, I should say, the renewal dates. But I don't know about a situation as complex as that one.
So there was 5 criteria that we used to redistribute renewals. Is that what we're referring to? I'm sorry, or just the end date?
Yeah, basically how they determine in a situation where there is different forms of coverage and different end dates for each one.
Okay, so I have a sense this is tied into the renewals. That's where I'm going with my gut. And we went ahead and we wanted to ensure that members had the eligibility for at least 12 months before their next renewal date. We also aligned renewal dates with all healthcare assistance groups on the case. We aligned the healthcare renewal dates with the food share renewal dates, if applicable. We aligned the healthcare renewal dates with the Wisconsin Shares childcare renewal dates, if applicable. And we also took into consideration how much time had passed since the case's application or the most renewal was completed. I do not believe that we pick and choose between the different categories of eligibility. It really was tied to their renewal date specifically. Adam, hopefully I'm answering the question.
I think so. That's a question that's come up before, and I don't know. I think it's one of those ones where we'll have to take back probably specific case numbers, Marcial, something when it comes up.
No, that sounds good. I'll have to. I hope Beth, I can count on you for keeping an eye on those particular follow-up questions that we have.
Sure thing.
All right, our next question says, I see a trend with Medicare Part D coverages ending for dual eligible individuals. Although it does make sense that this is happening, what happens if individuals are not Medicaid eligible anymore? Is there a referral process in place for those who are required to re-enroll in their Part D coverage for Medicare?
I do not know. Yeah, I just have to say, I do not know the answer to that question. We could definitely find out. Marcial, do you know more about that?
Is this the Medicare Part D question?
Yeah.
From Quintella. Yeah, I was gonna go ahead and take this one back or encourage folks to go ahead and connect with their local ADRC.
Yeah,
this is more of a specialized type question where I really encourage folks to work with their local ADRCs on that.
Yeah, that's what I was thinking too. Okay.
Awesome. Then I think we can keep on going.
Okay, cool. So we've got other insurance options. We've got people who maybe were found ineligible and need to go down a different route, which is where enrollment assisters like you can really shine. So I did tell people this would be kind of also our special enrollment period trainings, and so it is. But first, you're going to want to check for health insurance through a job. It's really, really important this time around for a few reasons, but one is that normally special enrollment period for a job might be 30 days, but when you lose Medicaid specifically, they have 60 days to enroll in employer benefits, which is really, really crucial because if they don't enroll and have an offer of affordable coverage, they're not going to be able to get tax credits to the marketplace. So finding out, number one, if they have an offer of insurance from a job, if you're assisting somebody, that is probably your first stop after finding out they're eligible for Badger Care. Definitely see, go through that coverage with them. And you're going to want to see, because they're going to look at the individual coverage and see if that's affordable. Thankfully, now the family glitch has been addressed. The rest of the family may be able to get into healthcare.gov while the individual takes the affordable coverage through their employer. So definitely want to pursue this option and find out if it's affordable. That's what I want the sisters to do. We have an affordability worksheet that's helpful. It's 9.12%, I believe, this year of monthly household income. Then healthcare.gov is obviously an option. It's based on income. This is our bread and butter in a lot of ways. Anyone who uses Medicaid can sign up at healthcare.gov anytime until June 31st, 2024. So ideally, you sign up before you lose coverage, so you don't have a gap in coverage. But special enrollment period for Medicaid will be continuous throughout the unwinding. But yeah, here's what I was getting at for health insurance from a job. Sorry about that. Okay, so let's get into the special enrollment period. CMS announced to do special enrollment period for anyone who loses Medicaid coverage from March 31st to July 31st, 2024. This is what I was just referring to. So to avoid gaps in coverage, they should complete their healthcare.gov application before they lose their Medicaid coverage. And they will be required to attest to loss of Medicaid, but they won't need to submit any verification of that to the marketplace. Now, for employer-sponsored coverage, people found ineligible for Badger Care but have that offer of insurance from the employer, they have 60 days, as I mentioned. The coverage must be considered affordable at the individual level, 9.12% of household income, and then really, really, really review carefully the offer of coverage, because if the individual plan is affordable, family plan is not, the family will have the option to go to the marketplace. So they can get tax credits to the marketplace, the individual will sign up through the individual plan there. So I'm just pleased, I think, for the first time in years to be able to say we have a solution to that particular problem, and it's coming up probably with some frequency given the unwinding. Employees do need proof that their Medicaid coverage is ended for the special enrollment period for the employer coverage. If they, reminder, just consumers who have an offer of affordable coverage and don't take it cannot get tax credits or healthcare. I can't emphasize that enough because it's a really hard conversation to have. When somebody comes to you and says, hey, I had an offer of insurance from my employer, I didn't take it, it seemed too expensive. You do the affordability, it turns out it was considered affordable, and then they can't get help through the marketplace. That is a hard conversation. And then if sort of misses their employer special enrollment period, they will have an open enrollment period, usually in the fall. And then this is a kind of trying to track down a resource on where to escalate place related to the employer-sponsored coverage issue. And the best thing I came up with was the Department of Labor's Employee Benefits Security Administration. They seem to handle some of the stuff, especially related to the COVID pandemic. So they have an email address there and a phone number for complaints and grievances related to employer special enrollment periods. If I get better resources to this in the future, I will absolutely provide. Special enrollment period, we have again, I told you I would cover this broadly. I think a lot of us, these sisters on here, know the special enrollment period we're going to be working with the most, which is this Badger Care plus loss of Medicaid. But just a reminder, loss of insurance, change in income household size, moving to a new zip code, immigration status changes, special life events. There's a lot we do that, it's going to be busy, and we're going to be seeing all of this stuff again. And then Medicare, as a navigator, I am not a Medicare agent, and I can only talk so much and get into so much trouble on Medicare. But I will say that there's a basic how-to sheet here, and refer you to your local ADRC and Medigap helpline. There is a special enrollment period set for Medicare Part A and or B. There's a 6-month special enrollment period, and then for D and Advantage, there's a 3-month special enrollment period. Let's do questions before resources.
Adam, there's a question of where can a person find the list of assisters?
Oh, that's a good question. I think Covering Wisconsin has our network map somewhere. I'll make sure that we follow up with this group with that. Otherwise, I should just say also WisCovered. Go to wiscovered.com, and I think Elizabeth could put that in the chat probably. Same thing with our site. It'll let you search by zip code, and you can find assisters in that area. That's probably your number one.
And I think this group would benefit from knowing the difference between an enrollment assister, a navigator, and a CAC, Adam. I think that would be helpful because we just got a question saying, what is an assister's qualification? And that just leads me to believe that, especially, we have another question of an individual asking if a social worker who is not a licensed navigator or CAC can still help with renewal and access. Just knowing the difference between enrollment assister who can use access, doesn't need to have training, formalized training like CACs and navigators with the healthcare.gov site.
Mm-hmm. Yeah, that's an interesting question and an important distinction. So certified application counselors and navigators and agents and brokers all receive state and federal training and certification to do this work, to handle PII, personally identifiable information, and to pass the exam to say, hey, I'm an expert in this stuff. And that gives us basically license to help consumers. That is kind of the OCI, the Office of Consumer Insurance. That's the recognized types of assisters. There are going to be people out there who are just helping someone fill out an access application, something like that. Helping somebody maybe if there's literacy or just math issues with income, things like that. There's definitely people out there, and they're important people out there going to be helping people sign up and renew their benefits, things like that. But I don't have the latitude to really say what's allowed and not allowed at that level. I can just say that if you go to a CAC, navigator, agent, broker, you're going to get the licensed help from somebody who's certified by the state. Does that cover it or no?
I think it does cover it. I think there's a need for understanding when you're helping someone do a renewal. That to me sounds like you're just coaching someone with the access websites, sitting next to them at a desktop, working through the renewal process, just making sure that they feel supported and that they're able to go ahead and complete the renewal. And then there's the other side of it where I hear somebody, can I help someone do the renewal? Meaning they're going to do it on behalf of that person, take the lead, enter, key in the information and all of that. You need to have permission in place, like being an authorized rep for that particular role. But if you're doing like supporting and such, I imagine that's what enrollment assisters do, CACs do, navigators do. Like, I have to do a renewal. I came to you and I applied to begin with. Can you help me just walk me through this? That's something that's doable. But when you ask it in writing here in the Q&A is whether or not they can do a renewal for somebody, that's a different format question. So
yeah, that was well put, Marcia. Absolutely. Maybe
Beth, if you want to go through the other ones, I'm trying to answer a different one.
Okay, cool.
Yeah, no, that's great. Most of them were just answered by you and Maciel with that. Let's see. Can you explain what the MAP program is?
Marcia, are you going to, or?
I'm gonna let you take this one and I'll chime in.
Okay, so it's one of the EBD programs. It's the Medicaid purchase program. It is an EBD Medicaid program that allows some limited work, I believe, and it has an asset test. So it's just one of the EBD programs, and I do believe it has premiums that have been suspended, and I don't know if they kick back in.
Yeah, I'll have to go ahead and bring this back, but that is one of the categories within the elderly, blind, and disabled Medicaid.
All right, how would we find a broker in our local area?
One of the things I would recommend is going on healthcare.gov and going to find local help. Reputable agents and brokers should be available through there, because they're updated annually, and sometimes more often. Otherwise, yeah, I'd call 211. Call 211 and get yourself an assistant. You don't need necessarily an agent or a broker. You can get a certified application counselor, navigator, whatever help you get, whatever assistance you get, enrollment assistance you get, should be free and unbiased.
Perfect. Have premiums for Badger Care returned?
I'm vetting that one. I don't have that one on the top of my head.
Okay, we'll find out.
Perfect. Looks like we can keep on going.
Okay, great questions, everybody. This is awesome. On for other resources. Okay, so this is these are my bookmarks. Badger Care Eligibility Handbook, Medicaid Eligibility Handbook. So if you want to look up things like what is MAP, the Access User Guide. I put the Access User Guide here just because I think that as we go through this process, we're going to discover that we, develop in our community some super users of Access and figure out some tips and tricks and things like that. And the user guide would be really helpful for that. But to practice an application, to practice seeing on Access, you could actually make an account on the Access training site and play around in there and get a feel for the questions and everything like that. So all really handy resources that will be linked in the final PDF that goes out. Similarly, we have our how-to sheets, depending on where you're at in terms of the process of helping consumers. The options for you and your family could make the most sense, or it could be other resources that community resources you're trying to refer them to. Those sheets, the new ones on losing Badger Care, are going to be really, really helpful. So if you're interested in our sheets, go to coverwi.org/learn. Reach out to us, reach out to me, reach out to Stephanie Sievers and Tina Marshall, and we'll figure it out. I just want to plug this training tool from DHS one more time, because I found these short videos on renewing, things like that, really helpful. I do think that without needing to reinvent the wheel, there's some good information there that people should definitely take advantage of.
And these are the videos that people have been asking for in the chat or in the Q&As. And just to let folks know, these links will be live on the presentation, so they'll be available there for sure.
Yep, 100%. And then I would be remiss if I didn't point out a scam alert. So sisters, this, this is a ripe time for bad actors and people trying to scam consumers out of their money, and with a scary kind of messaging that hits the media of like, oh, everybody's going to lose Medicaid. We just got word, I think today, of something similar happening in like Wyoming, where they were getting text messages that said, hey, you have to pay $500 to keep your insurance. And that's what we're going to see. So I just want to prepare everybody for that eventuality, is that we're going to see a lot of bad actors. We're going to see a lot of aggressive tactics used against consumers who are just worried about keeping the coverage. So keep an eye on them, report them to DATCAP, so at the bottom of the screen there, report them to OCI, and do whatever you can to protect consumers. Make sure they're talking to licensed people, make sure, I always say, ask the person you're talking to where they are. if it's a hard answer, then that's a really big red flag. It should just be immediate. But yeah, so keep an eye out for those because it's gonna be rough. Outreach materials from DHS, the Unwinding Partner Toolkit is available with flyers, matrix media tools, outreach cards, and more. And we have covered constant customized ones as well. And then same thing with our promotions toolkit, MCAN has one as well, and OCI. So there's a lot of resources to spread the word because this Unwinding is not just one and done. It's going to be a process. So definitely avail yourself of all the resources you can to make sure people know what's going on. And remember that we are here to help. This is our contact information. You can always call 211. Don't forget that. You can use our chat bot on our website. You can talk to a navigator live. And you can find local help on our site as well and connect to a navigator in your area. Questions?
So I have a follow-up on the question in terms of Medicare and the premiums.
Yeah.
When will they be in effect? And the Badger Care Plus premiums are not in effect right now, and the earliest that they can become effective would be January 2024. It's not a hard date. Of course, we would have to wait for CMS guidelines, but just wanted to give you a sense that we're not looking for those until maybe early next year.
Okay, good.
All right, when DHS does outbound calls for members who renewed too early, I'm concerned members will assume that those calls are a scam or that members will trust bad actors making similar calls. Has DHS looked into this, or, are they working on that?
Still in conversations to see what is being told to the IMs, what is being said, and all of that. So this is definitely something that I will be happy to bring back with them, but just know that everything is still a work in progress. So I'll be sure to share that with them.
Great.
All right, and this person is wondering if we can get a summary of enrollment assisters and navigators and if they're related to covering Wisconsin and DHS.
I think so. I mean, we have, like Elizabeth, I'm looking at you. We have those components, certainly. Yeah. I don't know what's put together. We can put something together if we need to.
Absolutely. Yep. It's yeah, we can add it in with what we send out. This person is anonymous, so I can't, send it directly. Let me see here. I think that's pretty much everything.
All right, let's do the last call then. Last call for questions, folks. Remember, the renewal can be easy, and it's not a fluke. It can be very easy. Just making sure, get the date and wait. Don't do it too early. If you take nothing else away, please take that away. And then, yeah, watch out for bad actors and take advantage of the resources that already exist.
Oh, it looks like I had missed one of the questions. So this person is wondering, if you're new to Medicare, do you start enrolling 3 months before you are 65? Over 65?
Navigators don't answer questions on Medicare, but that's when they start sending you things. I think in the mail is 3. You could start taking some action 3 months to 65.
And that would be an appropriate question for the local ADRC.
Correct. All right. Well, thank you all for your attendance. I really appreciate the great questions that are coming through and everybody's time, of course. So with this, I hope you feel a little bit better armed to go do this work and renew some folks, and we'll send out the evaluation and everything a little bit later. All right, big thanks to Maciel too for representing DHS and sharing all that great information, and Elizabeth, of course.
Happy to help.
Great. Thanks, everybody.